You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, smile makeovers. According to my first guest, he's calling it full mouth reconstruction. He says that no matter how bad your teeth are, nobody's too far gone to be able to have the smile they've always wanted. With us, we have one of LA's go-to dentists, Dr. Kyle Stanley. Dr. Stanley, welcome to the program.
Thanks for having me, Randy. It's great to be here.
Now, you brought a lot of photos, and we'll get to as many of those. And you come from a big dental family. I guess you've been a dentist your whole life.
Yeah, basically. I kind of grew up in a dental office. My dad's a dentist, my brother's a dentist, and then I became a dentist too. I guess it runs in the family.
So you have this concept in your practice, I guess, where you do everything right there.
Yeah, it's a little bit different than a lot of dental offices. So oftentimes, one person does the teeth, another person focuses on the surgery and the dental implants, another person, you go somewhere else and they take the CT scan. We do everything in one office. And it makes it nice for our patients. They don't have to go to and learn other parking lots and other teams and stuff, so it's really nice.
Now you do these special crowns that aren't traditional crowns.
Right, yeah, so we do biomimetic dentistry, which is like a little more, it's based on a natural tooth. We're trying to recreate the natural tooth, how it moves, how it looks, and we've done a lot of research on this. And this is what we teach at USC, actually.
Is that right? So tell me about your role at USC.
Yeah, so we teach the dental morphology, function, and aesthetics course. So Dr. Najad and I have both taught in the clinic and our preclinical courses. So we teach the first-year dental students.
On how to make a beautiful smile.
Yeah, exactly. We tell them how to design it, how it follows the lower lip and how it looks natural, what natural teeth look like, so they really understand.
So in the practice, you spend most of your time doing the surgery?
Yeah. So a typical patient for me may be a patient that comes in that knows they're losing their teeth. Someone else has told them that, or their teeth are loose, they have bad breath, bad gums, and they want to do anything to avoid dentures. Then they can come to me. They know me because of my expertise in dental implants, and I can place some implants, give them a full set of teeth that they can chew with, they can smile, they can blow out their candles at their birthday party, and really be confident. And then I have maybe another patient that comes in that already has dentures. And you don't have dentures, so you don't know, but they flop around. You can't really eat anything. You can't eat salads, cucumbers, corn on the cob. They come to me, and because they know I do guided surgery, that's very predictable, we can place implants, give them the smile they've always wanted, something that they can, be confident about. We also have the cosmetic cases, and the cosmetic cases, and this is where my partners come in. Okay, so they do more of the porcelain veneers and inlays and onlays, biomimetic dentistry. These are patients in their 40s, 50s, 60s. They have their teeth are stable, but they're gray, they're maybe yellow, they're worn down, they maybe aren't in the correct position. And we can do porcelain veneers, crowns, biomimetic dentistry, and get them back.
Okay, what is this biomimetic dentistry? You brought this up a couple of times.
Yeah. So biomimetic dentistry is something that we were taught, and this is actually what we teach at USC. So we teach biomimetic dentistry there. And traditional dentistry thinks that everybody needs a crown, right? And we've done a lot of research to prove...
But crowns work, right?
Crowns work. Yeah, crowns work to a certain extent. Maybe 5, 10, maybe 15 years. But the problem is you have to grind down about 80% of the tooth structure just to put a crown on it. Okay. So what biomimetic dentistry does now is, let's say you broke the side of a tooth. Now we can just bond on something just to that side of the tooth and leave the rest of the tooth in full function, and it looks much more natural and feels natural.
So like with one crown, instead of covering the whole tooth, that's what a regular crown is.
Right. A regular crown will cover the whole tooth, and we can just do the part that's, let's say, decayed, or the part that's broken. We can just bond that on, and we have really long success rates and a lot of research to prove this. So with biomimetic dentistry, traditional crown, you put a crown over it, and you don't really know anything's wrong until the patient comes in and says, this hurts.
So when you cover the whole tooth, if it starts decaying, you don't know.
You can't really see it. Okay. Yeah, you can't see it on an x-ray unless you can feel underneath it. So usually once we can feel underneath it, something's really bad. But with a biomimetic restoration, we see so much more of the tooth structure, so if there's any problems in the future, we can get it when it's just maybe a filling, or just something simple.
All right.
It's like if you have 4 tires on your car. Yeah. And one tire is made of metal. Okay, the crown is too stiff, so it doesn't allow all the forces to go through the tooth, then it goes into the root, and often you break these teeth.
All right.
So a biomimetic restoration actually moves like a natural tooth.
Let's talk a little bit about defining for the topic of today's show, because I know you do a lot of stuff.
Yeah.
Full mouth reconstruction, what is it? For a working definition.
Yeah. So full mouth reconstruction to us is usually kind of when a patient comes in with patchwork dentistry. So they've had, a crown here, they've had a veneer here, they've had an implant here, maybe their teeth are worn down, they maybe don't look nice. We think of everything as a whole. Okay. So we kind of step back and say, okay, you have a bite problem here, and they say, oh yeah, I know, I get pain here.
Yeah.
So we control their bite, we do aesthetics. If they need any surgery like dental implants or bone grafting, we can do that. It's really a holistic way of thinking and getting the patient to aesthetics, function, biology, and everything functions well.
So in your practice, this is your specialty, these broken down mouths. At the top of the show we said, you're never too far gone. You believe that? Some people just have really bad teeth, bad gums.
I definitely believe that. We get patients in all the time that say, Doc, you've never seen something this bad.
Okay.
Okay, and usually what I say is, well, I did my implant residency in Brazil, so I've seen some bad stuff that has come in. And also, when we teach at USC, we're right in the heart of LA. We see some of the worst stuff. So there's nothing that surprises us anymore.
Okay, good. So you brought some photos. Like what are we looking at here?
Yeah, so let me show you this one. So this is a patient that came to us, and this is really a full mouth rehabilitation, like the true definition. So the patient had actually had some cancer treatment. Okay, so his mouth was very dry. Almost every tooth in his mouth had decay in it. He had teeth that were wiggling and almost came out in an impression from a previous dentist, which is why he changed to go to a different dentist like us. Right. And this was a combination of implants, of porcelain veneers, of biomimetic dentistry, surgery, all put together. And now you can see he's got a great smile. It follows his lower lip. It looks natural. It's age appropriate, but it gives him a little more of a brightness. Yeah, he's in his 80s.
Oh, this is an 80-year-old.
Yeah, he's in his 80s.
Okay. So if this were a younger person, you would have made the teeth like a little wider?
Yeah, well, we try to make them age appropriate, but give them a little bit of an edge. Right. So like an 80-year-old probably wouldn't have really bright teeth. So we give them like a little bit brighter so that their friends don't say like, wow, I love your veneers, or I love your implants. We want their friends to say, wow, you have a beautiful smile. You look great. Have you been exercising, been eating well? Did you go on vacation?
All right.
Something like that. Yeah, we want the patients to say you have a beautiful smile and not, I love your veneers. So a patient like this, okay, he comes in, his teeth are wiggling in the back and he couldn't eat. It was hurting him in the back. Also, he wasn't really happy with the looks of everything, and he had decay everywhere in his mouth.
Is that when most guys come in, like when they're in so much pain, we put it off?
Yeah, it's usually when it starts to hurt, when they can't eat.
Okay.
That's when they come in. So imagine he came in like that, kind of somber and not really happy with his life at that time. And then when he finishes, it's like a beam of sunshine, Okay. He's smiling, he's talking with our front office, he's showing our assistants, what do you think? Don't I look great? And this is life-changing stuff.
So he can eat whatever he wants.
Oh yeah, now. Yeah. He's got implants in the back, and he's got veneers and biomimetic restorations everywhere else. So very, very stable. He can eat whatever he wants. He loves hard pretzels. Okay. All right. Hard pretzels. And that kind of sounds bad to a dentist. We like go, la 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 la. Okay. But he can eat that now with no problem. What's funny about this is a lot of, especially older patients, they'll come in, and it's just about the pain. Doc, fix the pain, that's it. And I say, well, we may be able to increase the aesthetics, make them look a little more natural, a little bit better, a little brighter. Nah, I don't really care about that. That was how he was.
All right.
And then we finish, and now he starts getting compliment after compliment after compliment. He's at the grocery store, he gets a compliment. He's getting his hair done, he gets a compliment.
So they forget about the pain.
Yeah, exactly.
And all they care about is this nice smile.
Yeah, and then everyone's like, wow, you look great for your age. No dentist would even know he had anything done. It's so natural.
It does look good.
We have perfect little imperfections. We don't like everything to look like a picket fence, like chiclets. These perfect little imperfections, this is what makes things look natural.
Do you think that because we've talked about this off camera, that if a guy like this may have gone to another dentist or something, they would have maybe extracted all of his teeth and giving him dental implants or a denture?
Yeah, unfortunately we see this a lot. So he was a patient that some other dentist had, like I told you, tried to take an impression and took the teeth out. And also a lot of people were telling him he needed to lose all of his teeth. We were able to save some of his teeth with biomimetic dentistry. The ones that unfortunately had to come out, we could replace with dental implants. And now it saved him some money too.
Okay.
Because he could save his teeth.
So this biomimetic, you brought it up again.
Yeah.
So people are just tuning in. Instead of a regular crown, you're just fixing the little part of the tooth that has a problem.
Right.
Is that kind of what
Yeah,
it is?
we don't have to like put the whole tooth in a pencil sharpener anymore to put a crown on it. We just fix whatever is broken or diseased.
That's an old-fashioned way, would you say?
Yeah, I would
like
say
the way
that's
crowns
like,
are being done is old-fashioned.
That's like how my dad was taught, in the 1970s, and people are still doing it today.
So look for a dentist that does this biomimetic.
Yeah, biomimetic dentistry. I would say look for a dentist that does that.
So that way you don't have to carve down the whole tooth.
Exactly.
Okay, good.
Yeah.
You brought more photos.
Yeah. So let me show you this one. So this is a patient that he actually comes to us from another state.
Okay.
And he comes in because he knew about some of the things of what we do. And he's a choreographer, okay? And he had lost half of his teeth. And he had one half left. And a lot of people have told him that he would have to lose the other half of his teeth. But he had teeth that we could save.
Like denture.
Exactly, yeah.
Okay.
And he's in his 40s. So what were his options? Denture was what a lot of people were telling him. And we told him, you know what, no, we can save a lot of these teeth. So we were able to place some dental implants, save the rest of his teeth with biomimetic dentistry, and give him that smile. I mean, if you look at it, it matches the lower lip perfectly to where it's balanced there. So when he smiles, no one knows he had anything done.
Okay.
And now he can speak, he can talk, he's in front of a lot of people talking. He feels comfortable. He can eat whatever he wants too.
Now you're a dentist. Right?
Yeah.
Your brother's a dentist.
Yes.
Your dad's a dentist.
Right.
You probably worked there when you were a kid in
Yeah.
the summers. So you probably think the smile's like the most important thing. How important is it?
Randy, it is one of the most important things. Okay, so in every survey ever taken on any magazine, smile is always either number one or the top three when you're looking for someone to date.
Okay.
Okay. The other thing is they've done a lot of research. Okay, a lot of research on the smile. A recent one, they looked at baseball cards from the 1950s. People that were smiling in their baseball cards lived an average of 8 years longer than those that weren't smiling. Okay, so
What's your take on that?
I think if you're smiling, you're happy. And if
Okay.
you're happy, then you're healthy. It seems pretty easy. Another research,
All right.
okay, that looks at brain stimulation in the reward center. They looked at how a smile impacts someone's life. So if I smile to you, your brain gets the reward center of eating 2,000 bars of chocolate or finding 25 grand in your cash, or of cash in your pocket.
Okay.
Okay, so if people are smiling, they're living a better life. I mean, it's everything. And if you don't have a confident smile, it doesn't have to be perfect. Okay, a lot of people say this. Do you have a perfect smile? No.
All
It has
right.
to be a confident smile.
So the
this is what we
charisma,
do.
like your charisma is tied to your smile.
Exactly, yeah. The smile's everything in life.
Okay.
If you don't like something about yourself, it holds you back. Let's say you don't like how your nose is, but no one else notices it. But when you go into a room, you're worried about your angles and how everybody's looking at it. It's the same thing with the smile. If there's something wrong with your smile, you can fix it. And you can be
Are
confident.
there that many people that really hate their smile that you
Yeah.
run into? It
Oh
seems
my
like an
gosh.
obvious one, but
It's everywhere. Like, let's say you're interviewing someone for a job. Okay, let's say you have twins, all right, or sisters.
all right.
And one's to sit there and smiling and she's friendly, and the other one is not. Okay, she's like this. Who are you gonna hire? You're gonna hire the one that's smiling.
Well, the one that looks happy,
Yeah,
right?
exactly.
Or enthusiastic.
Of course.
Self-confident.
Yeah.
Now, with so many people not liking their smiles,
Yeah.
they have the bleeding gums and the bad breath, and we're talking about full mouth reconstruction today. Do you think people just say, I'll just never have a good smile. I have bad gums. What if they do have bad gums?
Yeah, so that's a big misconception. People think if I have bad gums, then I'm doomed. I can't have a good smile. It's not true. Oftentimes, the gum problems are related to the teeth. So sometimes when we remove the teeth, we can place dental implants and these patients are fine. They can smile, they can eat whatever they want, they can chew on corn on the cob, and they can have salads and cucumbers, and they can eat whatever they want, smile all the time with confidence.
But if you're only missing one tooth,
Yeah.
right, just one tooth, why get a dental implant over a traditional bridge?
Okay, so a traditional bridge, they work. They work for maybe 5 to 12 years is what the research usually says.
Okay.
But the problem is you usually have to grind down the adjacent teeth just to put the crowns on it for the bridge. Another thing is that you're not stimulating the bone where the tooth was missing, so then the bone recedes. So now a one-tooth problem can become into a three-tooth problem. You're distributing forces of 3 teeth on 2 teeth.
Do you think it's, look, if there's 30, 40 million people with an upper lower denture,
Yeah.
do you think maybe it starts there with that one tooth?
Yeah, it
possibly? Do you think
becomes-
an implant stops that possibly?
I think so. It can stop the cascade.
Just give them their tooth back with a dental implant.
Exactly. One dental implant. It's a very simple surgery. and you can just replace that one tooth. You don't even have to touch the adjacent teeth. So they don't have that cascade, that downhill process of turning into these full mouth rehabilitations like we're talking about today.
Which can be expensive if
can
you wait
be.
too long.
If you wait too long, yeah.
Now, what if you're just missing like 2 teeth in the back? You say it's very common.
Yes.
And
yeah.
if they're not showing, why get a dental implant?
Well, here's the thing. You're missing some teeth. The opposing teeth will super erupt, meaning they come down into that space.
So if you're missing a bottom,
Yeah.
lower.
The top one will come down into that space.
Really?
And then you'll have to extract that top tooth. Another thing
Does
is,
that happen?
of course it happens. We see it all the time. But then let's say you're missing these teeth on the right side. On the left side is where you start chewing. So you're putting more forces on one side. You can break those teeth then, and this is that cascade like you were saying.
But what if you don't have the time? I mean, it can take like 8-9 months.
Yeah, but
do
that's
the
kind
dental
of an old way of thinking. There's a lot of new research showing that we can place the implant the same day, put a tooth on it, so the patient can walk out with a tooth. In certain cases, we can do
Okay,
this.
good. Now we're jumping around here. For people just tuning in, we're talking about full mouth reconstruction. According to Dr. Stanley, that you're never too far gone to have a beautiful smile. And we're talking about a combination of procedures.
Yeah.
And you have this holistic approach.
Yeah, so let me show you this case.
All right.
So this is the case that I did together with my partner, Dr. Najad. And this really shows the team atmosphere of how we do stuff. Because the patient came in and just said, I'm not confident with my smile, what can I do? And this is where we get both of our minds together. So I do the surgical aspect, and in this case I had to do some gum recontouring, okay, what we call like a gum lift, and some bone recontouring. And then Dr. Najad can come in.
What's wrong with those gums?
Well, because they're uneven. You know, they're uneven. So the mind sees that, and it just, something doesn't look right. We need a little bit more balance to the smile. So with him, it was hard because he had some baby teeth. He made the teeth looked very small because they were baby teeth, and the gums were uneven. So I had to go in, do some gum surgery, even out the gums. Then my partner, Dr. Najad, can come in, and then he can do those beautiful porcelain veneers, or like in this case, some composite veneers as well. And you can see how it matches the lower lip. The patient can smile. I mean, he is like beaming now. Before, he was one of those guys that would kind of do this. You know, he'd put his hand over his mouth when he was talking.
So this is one of the, I mean, you consider this like a full mouth case where you're doing everything, not just one thing.
Correct, yeah.
How did you turn those baby teeth into regular looking teeth?
We had to do the gum surgery on this to make them appear longer. So he can hold on to these baby teeth long. A lot of people would tell him he has to take these out. We were able to maintain these, and if he wants to do implants at a later time, then he can.
So some people keep their baby teeth, and maybe you would extract them and put in dental implants?
Yeah.
And you didn't do that?
No, we didn't have to in this case. His baby teeth were solid. We didn't see a reason to have to extract them. So let me show you this next one.
All right.
This is an interesting one. So,
oh my goodness.
yeah, so this is a trauma case. So he's a firefighter, and he got hit by a car. So he sends us that picture.
That's got to be unusual, though, teeth like that.
Not really. I mean, this was unusual in the sense that this was a trauma case, but we have a lot of patients that their teeth look like this just from neglect. And you never see it because they don't smile. You know, that you might think they're tough guys or something like that, but you know, they're just closed lips. Yeah, so with him, this was a true definition of full mouth rehabilitation. We had to do some surgery to splint the teeth. We had to do some porcelain veneers. We had to do some biomedic dentistry. And when you look at his smile, I mean, he actually said, okay, so this is kind of funny. He went through getting hit by a car, being in the hospital, you know, breaking his neck, all of this. And he said, I'm so glad that I got hit by a car because these teeth are better than my original teeth. So when we finished his teeth, it was actually almost the day before Thanksgiving. He looked in the mirror and he got a little emotional. You know, he gave me a big hug, and you see a big guy like this getting pretty emotional. It's really heartwarming, and this is really why I do what I do. Because we were able to change his life. You know, not just change his teeth. We're not just thinking about teeth. This is a smile. And he was able to go into Thanksgiving, eat what he wanted to, feel comfortable, be around his family. His wife actually called me that day and thanked me.
Is that right?
Yeah. Yeah, and I almost get emotional talking about it because...
Now, in the dental world, is this something like where the dentists get together and like this is a big one?
Yeah, well, you know, this is what we do every day, Randy.
Like broken down teeth?
Yeah.
Falling apart?
Yeah, this is what we do every day. These are the patients that we see. You know, people think just because we're in Beverly Hills, all we see are, you know, actors and Hollywood movie stars, but it's regular people with broken down teeth, and we can really change their lives.
So this guy, in one afternoon,
Yep.
you're able to do this in an afternoon. Let's talk about sedation, because you're big on sedation.
Yeah.
Because people don't like going to the dentist.
It's true.
Do you even hear that still?
You know,
Where
Randy,
they say, no offense?
okay, my wife,
Okay.
she's married to a dentist. She needs sedation. Okay, she grew up being afraid of the dentist. So no one likes to be at the dentist, you know? Even my friends will come to me and say, Kyle, you know, I love to come see you, but it'd be nice if I didn't have to see you that often, you know?
Okay.
So when we can put them under sedation, a conscious sedation, they feel very comfortable, they're relaxed, very safe. We can actually do, you know, 10 years of dentistry in an afternoon.
Because they're there for a long, I guess normally you couldn't hold your mouth open that long.
Yeah, it's hard to hold your
uncomfortable.
mouth open for a few hours and, you know, go through all the things that we do in the dental chair. And we do this a lot for like our businessmen. You know, guys saying, I've got one day and I need to fix everything.
They're busy
Yeah,
people.
of course. You know, or the busy mom. She doesn't have time to take off a week to get all her teeth done and come in multiple appointments. So we can put them to sleep, do all the dental work, they wake up, they're done.
Is it true they almost have an amnesia effect?
Yeah,
Or-
they don't remember anything, you know. I'll say, yeah, do you remember me taking that tooth out or putting that implant in? You know, I did the surgery, so they said, wait, there's an implant in there now? They don't remember.
So you know, we were talking a little bit that, you know, in the LA area, you're in Beverly Hills,
Yeah.
is that right? That there's a lot of people that their skin is good, even the guys, their shoes, they're driving the car, they got the
Right.
watch. You know they care what people think about
Yeah.
as far as their appearance, but they've got this old smile.
Yep.
So do you think it's their fear of the dentist?
I think
Or it's just a
oftentimes,
hassle?
yeah, there's a few things with it. People think that the dentist is expensive. And I think that's kind of an old way of thinking too, because we have financing. You know, we have
Okay.
third-party financing. We can make it affordable for almost anybody. The other thing is pain. People associate the dentist with pain, and they don't have to anymore. You know, things have changed now. People still think of the dentist as 1950s.
So you can rebuild a whole mouth,
Yeah.
and because they're sedated, they don't obviously feel anything.
Yeah, they don't feel anything and they don't remember anything. So they have a positive experience. All they remember is they come in, they see our, you know, our beautiful staff, and they look out the windows at the Hollywood Hills, and they wake up, and their mouth is done. It makes it much more easier.
Is it something they ask for?
Yeah, a lot of people are coming in asking for sedation.
What about the dental phobics? You get a lot of those? People
yeah.
that are just
Yeah,
really afraid?
We kind of specialize in the dental phobics. And that's why I love doing sedation, because you can take someone who's in pain but would never do anything about it to having a beautiful, confident smile. Just because we have the option of sedation. So, you know, we're talking about this guy, but I had a similar situation with another patient. So this patient came in and he didn't smile for 10 to 15 years.
That's what I told you.
Yeah, 10 to 15 years. Even when I asked him to smile, he went like this. Yeah, he didn't show any of his teeth.
Okay.
Okay, so he had broken down teeth. We needed to do gum work. We needed to do some surgery, some dental implants. We needed to do some cosmetic treatment. Really, it was a true full mouth rehabilitation. He actually had a denture on the bottom, and he told me this story that he went to a friend's house and he would always take his lower denture out. And his friend offered him a rib. And he took it, not remembering that his denture was out, and he tried to eat a rib without his lower denture. And this is when he said, I got to get my teeth done. He was sick of the pain, he was sick of not smiling and being embarrassed about it. So we were able to do a full mouth reconstruction on him, get him the smile that he wants. He changed his Facebook photo to be a picture of him smiling, okay? He takes pictures with his grandkids now, you know, smiling. He like smiles all the time.
So these people that do this, by the way, so when it's all done, is this the kind of thing where they say, I should have done this years ago?
Oh yeah, yeah. We never have a patient say, I'm glad I waited this long. They always say, God, I wish I should have done this a long time
Do you ever have
ago.
patients that that are, you know, in your practice as patients?
Yeah.
Like as we're clean, and they finally do something.
Yep.
Do they ever say, why didn't you talk me into this earlier? Does that ever happen?
Yeah. Oftentimes we'll say, you know, we mentioned this before, and they said, yeah, but like maybe you should have, you know, nudged me a little more because this changed my life. You know, my marriage is better, or now I'm dating. You know, we have a lot of people in their 60s, 70s, 80s, 90s that are dating now, and this becomes a trigger for them to do their teeth.
Are there a lot of, now, because you're in Beverly Hills, I mean,
Yeah.
are there a lot of like CEOs or actors that have bad teeth?
Yeah, you'd be surprised.
That for whatever reason, they're just putting this thing off.
They put it off, yeah. Oftentimes I think, you know, life gets in the way, right? Career, family, whatever it is. But then when they start to realize the impact that it can have and that it's impacting their life, I'm not smiling, so I'm not meeting friends, or I'm not getting the job I want, I'm not getting this or that, then that's when they come in. And that's when we change everything.
All right, final message. Somebody's watching this, right? and their teeth are really bad. They're broken down.
Yeah.
They're falling apart. Maybe they think they need a full mouth of extractions, and they're headed to a denture. What do you say to them?
I invite them into our practice. You know your options, okay? Can we save the teeth? Do we have to do some dental implants? Is it a full mouth reconstruction? The earlier they do it, the less it's gonna cost, the easier it's gonna be. So it can actually save you some money.
And it doesn't have to cost more, we talked. I even asked you certain prices on the phone.
Yeah.
And it's, in some cases, less than here in San Diego. But just because you're in Beverly Hills doesn't mean it's going to be more.
No, it doesn't
Is
have
that
to
true?
cost you more to
I'm
go
not trying
to
to side
someone.
with you. I'm just.
Yeah, it doesn't have to cost you more to go to someone that is an expert in the field.
Okay, so you have Dr. Najad.
Yes.
He does like more of the cosmetic stuff.
Yep. Right. So
this
Dr. Najad.
biomimetic dentistry.
Right. Yep. And then we have Dr. Helm, who does more of the general dentistry.
Okay.
And then I really focus on the surgery. So dental implants, gum surgery, extractions, wisdom teeth.
Now, I know you wanted to bring up this guided surgery because you're big on guided surgery. What
Yeah.
does that mean? Because
Yeah.
not everybody, I guess, is doing guided surgery for
Right.
dental implants.
Right, yeah, this is what I teach a lot. I travel around teaching other dentists how to do this. We actually, let's say you need a dental implant, okay?
Missing a tooth.
Yeah, you're missing a tooth, 1 or 2 teeth in the back or whatever. And I will actually take the CT scan, so the 3-dimensional x-ray, I'll put it on my computer and I will actually do your surgery on my computer. So when it's time to go into surgery, we've already done the surgery, I know exactly what's gonna happen, and I even have a guide that's gonna make sure the implant is placed in the exact position.
So like a guide that goes in their mouth
Yep.
and you just put the implant through.
Correct, yeah, it goes through that guide, so it's the safest, most predictable way of placing dental implants.
Well, how is it normally done?
Usually this is what people do, okay? So they open up the gums and they start looking for bone. Where can I place bone? And they do it by hand. And we're humans,
Does this
we make
happen?
mistakes. This is how
this is-
95% of doctors
Really?
are doing it, yeah. And this is how implant dentistry was always done. But now I'm trying to change this.
Okay, so you're teaching this at USC.
Yeah, I teach this at USC and I travel around the world teaching other doctors how to do guided
Do the
implants.
guided surgery. Well, why
Yeah.
doesn't everybody do guided surgery? I mean, you make it sound like it's easy if you
Yeah.
do guided. Why wouldn't everybody do it that
It
way?
becomes easy when you do it as much as I have, but you need proper training, you need some special software, and it's great. I mean, this is what I do for my patients every day.
Okay, so if you're missing 1 tooth or
1,
3
2,
or 4
3
teeth,
teeth, yeah.
get an implant.
Get an implant and make sure it's done by someone who's using guided surgery. It's the safest, most predictable way of doing dental implants.
So like you or Dr. Najad, they're going to see.
Yeah,
And
for
I've talked to
sure.
him on the phone. Great guy.
Yeah, he's awesome.
I wish he could have made
He's
it
my
today.
dentist, actually.
Oh, is that
Yeah.
right? Okay, good. Thanks again.
Thanks
Good
a lot,
stuff.
Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.